Would you be prepared if an emergency occurred in your medical office? Recent studies show that emergencies occur frequently, yet the offices of many physicians are not well prepared. The good news is, your office can improve. This video, part of a not-for-profit research project from the University of British Columbia, is designed to be viewed by anyone in your medical or dental office to learn about the required equipment and the necessary training to streamline your response to any office emergency. This video will show you 3 steps to improve emergency response, including preparation you can do in your office today. Step 1. Ensure your office has the right equipment. Currently, there is no widely accepted standard for mandatory resuscitation equipment for a physician's office, and only 2 provinces have published a list of mandatory equipment. As well, the Canadian Medical Protective Association is not mandated to provide such guidelines. However, guidelines have been published for family physicians, dentists, and pediatricians. These guidelines recommend that every office has the equipment listed here as a bare minimum. Note that recommended equipment does not include endotracheal intubation equipment. Like any skill, intubation should only be performed by practitioners who regularly perform it. In fact, in the pre-hospital setting, bag valve mask ventilation has been shown to be more rapid and more effective than endotracheal intubation, with no compromise in outcomes. Many physicians considered the cost of equipment to be prohibitive, yet a 2011 audit of Canadian prices showed that most basic resuscitation equipment can be obtained for less than $101. In addition, your office should also consider obtaining an automated external defibrillator. In an emergency, waiting for an ambulance to bring a defibrillator can be deadly. The benefit of defibrillation declines every minute a shock is delayed. Some offices will require additional equipment. Use an appraisal questionnaire to find out what equipment is recommended for your particular office type. Step 2. Streamline your response to emergencies to provide faster, more organized care. Organize the equipment in your office, improve response time and patient safety by creating individual medication boxes. Label each box clearly with each type of emergency, and include a clear list of medications and doses for adults and children. Additional tools can help streamline a response to an emergency. For example, a pylon can be placed outside of a room during a resuscitation to clearly identify where help is needed. Create a process so that equipment checks are routinely and thoroughly completed. For example, every Monday by the clinic nurse. Using a checklist can ensure the equipment is always ready for use. Post information at the reception desk to help staff recognize which patients require emergency care. Staff should be trained in how to activate an emergency response in your office and should be encouraged to call a code blue even before fully assessing a patient. This helps practice the office emergency response and is safest for the patient. A cue card can also help staff provide the information a 911 or emergency operator may request. Step 3 is to ensure everyone in your office is adequately trained. This list shows the most common emergencies encountered in adults and children. Make sure that everyone in your office is trained to use algorithms to manage these common scenarios. Each staff member should know what role they play in an emergency. In addition to training in the office, all staff should have some level of emergency certification, whether it be CPR with AED, ACLS, or PALS. Simulation is the best way to improve patient care in an emergency, and all published guidelines on this topic recommend the use of mock codes. Mock codes, especially when unannounced, have numerous benefits, shown here. Mock codes are important because simply distributing guidelines has not been shown to improve response to an office emergency. Practice is essential. Routine mock codes are inexpensive and take minimal time. Surveying your team before and after your practice session can reveal areas for further development. For example, when reviewing one mock code, a nurse noted that oxygen was not started even though an infant was turning blue, because the nurse did not have a doctor's order. In another case, an office staff member recognized that a patient was in severe distress, but did not call 911 because they thought the physician would want to make the call. Studies show that many offices failed to call 911 in an emergency. Reviewing mock codes can help prevent these errors when a real emergency occurs. In closing, here are some ways you can apply these 3 steps in your office today. Appraise your office. Download and complete an appraisal questionnaire to find out if your office is ready for an emergency. Share the results of your appraisal, along with this video, with the management at your clinic. Organize the equipment and medication in your office. clearly labeled doses for adults and children, and develop a process to make sure the equipment is routinely checked. Post information at the reception desk about identifying emergencies and activating a response. Develop algorithms on managing common emergencies. Identify a staff member who can be responsible for setting up emergency training for all staff in your office. Using the steps outlined in this video, you and the team at your office can improve your response the next time an emergency occurs. You can find reference citations, more information, and resources available for download at our website. As well, if you would like to share this video with your colleagues, you can download a poster free of charge at OfficeEmergencies.ca.